Hi, this is George with 573 Medicine, and in this video we're going to be talking about the placenta, fetal blood flow, urachus, and umbilical ligaments. So let's get started. First, let's talk about the placenta. The placenta is an organ which is the primary site of exchange of nutrients as well as gas exchange between the mother and the fetus. There is a fetal component which consists of the cytotrophoblast that makes up the cells of the embryo, as well as the syncytiotrophoblast, which secretes beta-HCG. And beta-HCG is the hormone which stimulates the corpus luteum to secrete progesterone early in pregnancy. And the syncytiotrophoblast lacks MHC1 receptors to prevent autoimmune destruction of this fetal component. The maternal component consists of the decidua basalis, which is a highly vascularized area of the endometrium, which is the inner lining of the uterus. Next, we're going to be talking about blood flow, fetal blood flow, and it's important to understand this picture. So red blood, such as blood from the umbilical vein, is oxygenated. Blue blood, such as from the inferior vena cava, is going to be deoxygenated. And purple blood is going to be a mixture of deoxygenated and oxygenated blood, so partially oxygenated. Remember that the site of gas exchange in the fetus is the placenta, and this is because of underdevelopment of the fetal lung parenchyma. So oxygenated blood from the mother is going to be carried to the baby through the placenta, and this is going to be through the umbilical vein, which is counterintuitive because typically veins do not carry oxygenated blood, but in fetal circulation, the umbilical vein carries oxygenated blood. Remember that typically blood will have to be drained. Oxygenated blood will eventually be drained from the liver through first pass metabolism. However, in the fetus, this is not advantageous because there is so much congestion in the portal circulation. So there is a structure called the ductus venosus, which actually allows the oxygenated umbilical vein to not pass through the liver and actually go directly into the inferior vena cava. So the umbilical vein, oxygenated blood from the umbilical vein is going to mix with the deoxygenated blood in the IVC, and it's going to be purple. So the inferior vena cava now has a mixture of oxygenated and deoxygenated blood. And the inferior vena cava is going to feed blood into the right atrium. So now that blood is in the right atrium, it can move in two different directions. The first is that through this structure right here called the foramen ovale, blood can move from the right atrium to the left atrium. And from the left atrium, it can move into the left ventricle and go directly into the aorta. Additionally, blood can flow from the right atrium to the right ventricle and go into the pulmonary artery. And remember that the parenchyma of the fetal lungs does not do gas exchange. So what ends up happening is that a structure called the ductus arteriosus will allow blood from the pulmonary artery to directly go into the aorta and bypass the left heart chambers. Lastly, umbilical arteries are going to be paired vessels that carry deoxygenated blood back to the placenta for gas exchange. Something that might help you remember the difference between the ductus arteriosus and the ductus venosus is that the ductus venosus is with the umbilical vein and the ductus arteriosus is with the pulmonary artery. Next, let's talk about the Allantois. So this is an embryological structure that actually connects the bladder to the umbilicus, and this drains fetal urine in the first trimester. The walls of the Allantois actually develop into the umbilical artery and the umbilical vein. And you can actually appreciate the allantoic duct, which is the lumen of the allantois, on an umbilical cord cross-section. When the allantois obliterates, it becomes the urachus. So next, let's talk about umbilical folds. We have one median umbilical fold, and this is going to contain the the remnants of the fetal urachus, and it's going to be overlying the median umbilical ligament. So the median umbilical fold overlies the median umbilical ligament, which is a remnant of the fetal urachus. There are going to be two medial umbilical folds that overlie the medial umbilical ligament that is the remnants of the obliterated fetal umbilical artery. Lastly, there's going to be the lateral umbilical fold, And this is just simply going to be overlying the inferior epigastric artery and vein. And remember that the inferior epigastric artery and vein are going to be branches of the external iliac artery. And this is important not only because these vessels supply the abdominal wall inferior to the umbilicus, but also the inferior epigastric artery and vein is going to be incredibly important because they form the lateral border of Hasselbalch's triangle. And that is going to be used to classify different types of hernias. Additionally, there is anastomosis with the superior epigastric artery, which is a branch of the internal thoracic artery that supplies the anterior abdominal wall.